Assalamu alaikum. My name is Dr. Beenish Syed, and I work as an infectious diseases consultant at the Sindh Infectious Diseases Hospital and Research Center. As you all know, that we are celebrating the World Antimicrobial Resistance Week this week. So, a very important part to combat antimicrobial resistance is the antimicrobial stewardship. And today I'm going to give you a brief review of what antimicrobial stewardship is about. So let's begin. So what is antimicrobial stewardship? So according to the IDSA, which is the Infectious Disease Society of America, and SHIA guidelines, it's basically, these are basically coordinated interventions designed to improve and measure the appropriate use of antimicrobial agents by promoting the selection of the optimal antibiotic drug regimen, including the dosing, duration of therapy, and route of administration. So basically, it's like antimicrobial stewardship works as a balancing act between the starting initial antibiotics, keeping in mind the target of patient outcomes, improving the patient outcomes in healthcare, and the unnecessary use of antibiotics, which ultimately leads to increased resistance and cost. And this diagram actually shows you this phenomena. Next up, so what are the basic goals of antimicrobial stewardship? Antimicrobial stewardship has three main goals. The first goal is that appropriate antimicrobials are prescribed with correct dose and duration. The second goal is to prevent antimicrobial misuse. That is, it should not be used overly, overuse and abuse. Third goal is to minimize the development of resistance by making sure that the antibiotics are given in the correct dose and where appropriate. So this diagram basically shows how antimicrobial stewardship works. You need a team. It's not just a single person's job. You need a whole team. And in the center of this team are the ID physicians, mostly the clinicians, which include ID physicians and the clinical pharmacist, and obviously administrative support in the form of hospital directors or any other kind of administrative support. So other stakeholders that can be involved are the hospital and nurse administration, the epidemiologist, the infection prevention control team or the committee, obviously the MIS, information system, to provide the support, IT support. Microbiology is very important. Obviously, you need to know the cultures. Clinical pharmacy specialists who actually know how this stewardship works, and decentralized pharmacy specialists. Other than that, other physicians in the hospital, including the emergency department, the hospitalists, the intensivists, and surgeons, they should also be a part of this team. And obviously, infectious diseases physicians and or the infectious diseases department and the administrative department, including the chairman of the pharmaceutical and therapeutics committee of the hospital, play an important role. Antimicrobial stewardship core strategies. So how does antimicrobial stewardship works? So basically, for the antimicrobial stewardship to work, there are two major strategies. One is the front end or pre-prescription, which means that before starting an antibiotic, you need a pre-authorization or a prior authorization. Basically, the administration or the pharmacy department of the hospital classifies some antimicrobials as restricted, and they can only be issued or they can only be used after prior authorization, mostly from the ID physician or the ID department. Then the next approach is the back end or post-prescription. Here, the pharmacy department and the ID physician and the microbiology and other stakeholders in the antimicrobial stewardship play a role. They actually do rounds, and um, they do active surveillance of the antibiotics being used, and then they give uh, feedback to the physicians who has prescribed that whether this antibiotic is being used appropriately or not, and they advise the appropriate corrective measures for that as well. And an example for this is de-escalation, where you cut down or adjust the antibiotics according to the cultures, or stop the antibiotics when it is no longer required. So what can you do to be a part of the antimicrobial stewardship team and overcome the antimicrobial resistance? So the first thing to do is obtain appropriate cultures before starting antibiotics, so you can target the therapy later on when the cultures are available. Review the antibiotic use in 48 to 72 hours, whether they need to be continued or not. You're dealing with a non-infectious process or an infectious process, whether it is warranted or not. Stop the antibiotics in patients with alternative. And once you have reached that a diagnosis that the thing you are dealing with, the condition you are dealing with is non-infectious, you can actually stop the antibiotic. Another important thing are the dosing and duration of antibiotic therapy. You need to optimize that. Avoid unnecessary use, especially viral URIs or upper respiratory infections. So what happens is 75% of the time, upper respiratory infections that we deal with, especially in pediatric age groups, they are of viral origin and they do not need an antimicrobial therapy. So as physician, you have a part in avoiding unnecessary use of these antimicrobials, especially in conditions like these. So this picture basically shows all kind of upper respiratory infections that can have a virus cause. The conditions like cold, flu, chest cold in otherwise healthy immunocompetent adults. Sore throats, except obviously the strep throat, bronchitis, runny nose within the middle ear, they're all usually caused by viruses and they do not need antibiotic. Another frequent condition which does not warrant an antimicrobial use are the acute diarrheas. Majority of these diarrheas are also caused by viruses, and only about very few cases, like about 13% of the cases or 14% of the cases, are caused by bacteria that need antimicrobial therapies. So this is another important aspect, another important condition where you can avoid antimicrobials or unnecessary use of antimicrobials. We generally see a lot of antibiotic prescriptions in these two conditions being prescribed in these two conditions, like the upper respiratory infections and acute diarrheas. So in the end, always remember, drug resistance follows the drug like a faithful shadow. So what our job is, and especially when we are commemorating this microbial resistance week, is that we should always remember to use our antimicrobials wisely. Thank you.